Welcome to This Explainer. Today, we're diving right into the profound paradigm shift that is completely transforming healthcare by 2026. We're finally moving away from those old, fragmented treatments and shifting toward treating the whole person. It's this absolutely fascinating intersection of massive cultural shifts, eye-opening new data on childhood trauma, and some seriously powerful digital infrastructure. Here's our roadmap for today. We'll start with the 2026 healthcare shift, look at the lifelong impact of ACEs, explore the digital tools driving change, dive into a new mental health era, and wrap up with the power of integrated care. Let's get to it. Section 1, the 2026 healthcare shift. We are moving beyond the mind-body divide. Think about it. For decades, the medical field basically operated under this illusion that the mind and body were entirely separate things. You'd go to one building for a broken arm and then deal with a completely different, disconnected system for anxiety. Well, thankfully, we're finally transitioning away from that old, reactive model. We're moving into a proactive, integrated environment. Digital-first, preventative care is now anticipating issues way before they happen, treating your physical and mental wellness under the exact same umbrella. It's a real game changer. Moving on to Section 2, the lifelong impact of ACEs and how the past shapes our physical future. To really grasp why the shift is so absolutely crucial, we have to dig into the root causes. We're drawing on some massive studies concerning adverse childhood experiences, or what we call ACEs. So what are they? We're talking about long-term, repeated, potentially traumatic events that happen before the age of 18. This includes things like abuse, neglect, or household dysfunction like parental substance misuse or divorce. By 2026, the medical community fully recognizes that these experiences don't just stay in the mind. They physically alter neurological development and drastically increase the risk of chronic diseases decades down the line. And get this, the data shows a shocking 63% of adults have experienced at least one ACE. That's nearly 2/3 of the entire population. So this isn't just some fringe or isolated issue. This is a widespread public health crisis. It literally means that the majority of people walking into a doctor's office carry an underlying risk factor that traditional, siloed medicine has just completely ignored for years. Now, the danger really compounds when a person is exposed to 4 or more of these ACEs. The risks multiply drastically. We're talking about a 4.8 times high risk for depression, 3.9 times higher for high-risk HIV behaviors, and almost triple the risk for heavy smoking. But it doesn't stop at behavior. The study shows these individuals are at a far higher risk for severe physical conditions too, like COPD, cardiovascular disease, and even cancer. It turns out toxic stress quite literally changes our biology. Furthermore, childhood trauma often perpetuates socioeconomic inequality, which in turn deeply exacerbates those physical diseases. Because ACEs can impair cognitive development and emotional regulation, they often end up limiting a person's educational and earning potential later in life. In fact, an income of less than $25,000 directly mediates a significant portion of the risk for conditions like diabetes, disability, and COPD. Treating the physical illness without understanding the economic and traumatic context, well, it's basically like bailing water from a sinking boat without actually patching the hole. Okay, let's jump into Section 3, digital tools driving change, or the infrastructure of modern care. So we know the whole person needs care, right? But how do we actually practically deliver that at scale? Well, by 2026, AI is the answer. And I'm not talking about vaporware anymore. It is quietly and powerfully amplifying good clinical workflows wherever the data exists and the return on investment is clear. For example, in radiology, it's flagging hidden abnormalities that human eyes might just miss during a really busy shift. In primary care, it's triaging patients way faster to get them to the right specialist. And in administration, it's turning hours of manual paperwork into minutes by instantly extracting data from clinical notes. But here's the thing. None of this advanced tech works without interconnectivity and deep trust. Remote patient monitoring for conditions like high blood pressure is continuous now. Those clunky old fax machines, yeah, they are finally dead, replaced by FHR-based APIs that allow systems to talk to each other securely. Virtual care has evolved into seamless asynchronous messaging and full-on hospital-at-home care. But the absolute foundation of all of this, the whole shebang, is strict data privacy built in from day one. Patients are only going to trust this whole person monitoring if they know for sure that their highly sensitive data is entirely secure. Section 4, a new mental health era, focusing on everyday emotional literacy. As our technology evolves, our culture is undergoing a massive shift right alongside it. Mental health care in 2026 is no longer confined to hidden therapy rooms. Today, preventive care is a routine norm, and emotional literacy is actually taught as a vital life skill. Chronic sleep issues and workplace burnout, they aren't dismissed as personal failures anymore. They're treated as critical diagnostic medical signals. Even substance use is addressed without the old stigmas because it's understood fundamentally as a medical condition tied back to those early ACEs we discussed a minute ago.
We are firmly and thankfully replacing that old model of just waiting around for an emotional breakdown. Instead, we have a continuous, personalized approach. Mental health care is becoming a form of ongoing proactive maintenance. It's really about building long-term coping skills way before life feels overwhelming. You make adjustments early, just like you would with your physical fitness or your dental care.
Which brings us to Section 5, the power of integrated care, treating the whole person in one place. This is where primary care and behavioral health finally merge into one cohesive system. The absolute gold standard for this is the collaborative care model. It's an evidence-based approach where you, the patient, have a primary care team, a behavioral health care manager, and a consulting psychiatrist all coordinating together behind the scenes. By treating mental and physical health in the exact same setting, we drastically reduce the stigma. You don't have to navigate confusing insurance networks to go out and find a therapist on your own anymore. Your primary care team just handles the whole thing. To highlight the incredible efficiency of this model, consider this massive number, 226,800. A single consulting psychiatrist working within the collaborative care model can serve up to 226,800 patients over their lifetime. To put that into perspective, that is about 13 times more than a psychiatrist operating in a traditional one-on-one practice. Because they're acting as a consultant to the primary care teams, their expertise cascades down. They're impacting entire populations rather than just seeing a few individuals a day. So how does this actually work in practice? A key part of this workflow is the step-by-step SBIT approach: universal screening, brief intervention, and referral to treatment. This normalizes mental health checks right alongside your physical vitals. Think about it. When you go in for a physical, they check your blood pressure, right? Well, now they also universally screen you for depression or anxiety at the exact same time. If a flag is raised, an intervention happens immediately, right there in the clinic. No more falling through the cracks. The real-world results of this integrated approach are absolutely staggering. Patients receiving collaborative care are 54% less likely to require costly emergency room visits and 49% less likely to need inpatient psychiatric hospitalizations. By catching the effects of early trauma and everyday stress upstream, we are actively preventing catastrophic and incredibly expensive health crises downstream. Ultimately, when you screen for mental well-being the exact same way you check blood pressure, you validate the single most important truth of 2026's healthcare shift. Mental health is health. There is literally no divide anymore. The trauma of our youth, the stress of our daily jobs, and the biological functions of our organs, they are all intimately, deeply connected. As we look toward this integrated, whole-person future, a future where technology actually empowers compassion rather than replacing it, I want to leave you with one vital question to reflect on regarding your own wellness journey. Is your healthcare right now just treating your isolated symptoms, or is it treating you? Thank you so much for joining me for this explainer. Keep asking the right questions and stay curious.